Okay. Well, let's start with this, and we'll run through. No, in fact, I don't think I did this with you guys. I went through the actual PowerPoint one, but not this one. Okay. So just a couple. Let's do a little bit of just finish up some labeling here. Okay. Talking about the olecranon process. This is that bony part of your elbow. So this part right here. So when you tap the back of your elbow, that's what you're feeling. Okay. And that's on the posterior part of the ulna. On the anterior part, that's the trochlear notch. That is the part of the ulnar that attaches onto this structure right here called the trochlea. Remember that bow tie type of structure that I was describing to you about that's on the humerus? I'll show it to you. We'll come back to the slide right here. There's the humerus, and here's the trochlea right here. Okay, so when you look at the ulna, okay, and that trochlear notch, it kind of just chomps on to the trochlea there. The trochlea will fit nicely in this little groove here. So this bottom portion here, all right, pay close attention to the spelling, but let me, whoops, I'm jumping ahead. Here's the trochlea from the anterior view. So the trochlea would sit right in here like this. Okay. So this bottom portion right there, that's the coronoid process. So you make sure, look at the spelling, C-O-R-O-N-O-I-D, coronoid. We also saw the coronoid process of the mandible, right? Remember that was that shark fin shaped structure right in front of the mandibular there, in front of the the condylar process of the mandible. Okay, so that make sure that you are differentiating between the coronoid process of the ulna and the coronoid process of the mandible. Here's the coronoid process of the ulna from the anterior view. All right, and then there's two parts or two spots where the radius and the ulna actually touch one another. And this is one of those spots, the radial notch, okay? The head of the radius, which kind of looks like this structure, okay? It butts up right against the radial notch there. All right, so that's all on the proximal end of the ulna. We go down to the distal end. All right, you can see a little nubbin here. All right, that's the styloid process. If you're squeezing your wrist on either side, you'll feel two bones. All right, the one on your pinky side, that's the styloid process. The one on your thumb side, that's the styloid process of the radius. This is the styloid process of the ulna. All right, let's jump over to the radius now. This is the shorter of the two bones. We're at the proximal end here. Okay, the head of the radius is kind of like it looks like a nail's head. You know, it's kind of shaped like that. And then just distal to that, where it starts to narrow down, that's the neck of the radius. And then if you notice, just below the neck of the radius, there's a little bit of a bump on the radius, and that's the radial tuberosity. Your biceps tendon inserts on there. And you can feel your biceps tendon in the front of your elbow. All right, it's called the cubital fossa. If you flex your elbow at 90 degrees, you'll feel a tendon there. That's your biceps tendon. All right, let's go down to the distal end of the radius. You can see there's a little nubbin at the bottom. That's going to be your styloid process of the radius. All right, then opposite of that, on the other side of the radius is a smooth little area there, and that's going to be the ulnar notch. That's where the ulna, all right, that's the second spot that the ulna and the radius touch each other, okay? It's the ulnar notch. It's on the side opposite of the styloid process. All right, next we're going to run through the bones. Remember, there's 8 of them. There's 2 rows. You have a proximal row and a distal row. We're going to start with the proximal row first. That's going to be the row that's closest to the bones in your forearm. Okay? That's this row right here. This is the proximal row. And then this is the distal row. The distal row, the bones articulate with these bones. These are the metacarpals. So the first bone is the scaphoid. You guys remember the mnemonic? All right. Silly lovers try positions that they can't handle. All right. Scaphoid, that's the first one. All right. Our second bone is the lunate bone. Now it's not this whole bone here. Okay. It is where I'm drawing this line here. That is because there's two other bones in that same row. They're just, the way this looks, they're all just laying on top of one another. Okay? So that's the lunate where that arrow is pointing, highlighted in blue. All right? The next bone is the triquetrum, and that's this bone here that I'm going to try my best to highlight for you. And then the final bone is a small pebble-like bone. That's the pisiform. That's that bone right there. And you can feel that right on the palm of your hand. You'll feel a little bone right there. That's your pisiform bone.
So this is like this view of the hand?
Mm-hmm.
Like
Yep. Yep. All right, so that's it. Yeah. Which one do you want me to go back to? This one? Triquetrum. The distal row is a little bit easier. All right, so the distal row is the second row of 4, and the first bone, all right, is going to articulate with the first bone in your thumb, so they both have an sound to it. So trapezium articulates with thumb. You're very welcome. So this is metacarpal number 1. So the trapezium articulates with metacarpal number 1. Okay? The next bone is going to be the trapezoid, and that articulates with metacarpal number 2. Roman numeral number 2. The next bone that we see is going to be the capitate, and that articulates with metacarpal number 3, Roman numeral number 3. And the last one is going to articulate with 2 metacarpal bones, metacarpal bone number 4 and metacarpal bone number 5, and that's going to be the hamate. This is 4, this is 5. All right, so let's run through the metacarpals real quick here. All right, starting with the thumb, that's metacarpal number 1. These are the bones that are in the palm of your hand. They're in the palm of your hand. So the next one, your index finger, is metacarpal number 2. So in case you're wondering when you're taking the test, okay, that these Roman numerals are capital I's, and then for 4 and 5, use Roman numeral capital V. All right, here's the third, your middle finger there, okay, that is going to be Roman numeral number 3. All right, and then you got Roman numeral number 4, that's your ring finger, and then you guys probably guessed it, there's Roman numeral number 5. Okay, so the nice thing about this next part is, all right, the same pattern that we see in the hand is going to match the foot, so that's easy. Okay, you have 14 phalanges in your hand. You're going to have the same number in your foot. Okay, so every single finger has a proximal phalange. Okay, that would be this row, and every single finger has a distal phalange. That would be that row. but only digits 2, 3, 4, and 5 have what we call the middle phalange. Okay? Just keep that in mind. And you can count the knuckles. If you look in digits 2 through 4, you got 2 knuckles on each finger, not including the knuckles by your metacarpal heads. Okay? But you have 2 knuckles. Your thumb only has the 1. Easy to remember. Okay? So let's take a peek at some of these. I'm not going to go through every single phalange because I'll let you fill in the rest. Here's proximal. You can say phalange or phalanx. Okay? So phalange is PA. Whoops. Oh, you're writing that down here. Phalange. That's how you spell phalange. All right, so you can either put phalanx or phalange, either or. Okay, but that's the first one here. Thumb is always digit 1. Pinky is always digit 5. So proximal phalanx or phalange 1. Okay, and then you can see distal phalanx 1. All right, and then I'll do the next finger, then you can fill out the rest. All right, then we got proximal phalanx 2 right here. This one right here, that's metacarpal 1. That's this one up here. That one.
So like on the test, could you give us a right hand or a left hand?
And ask you which is which.
I know, I mean, like consider it be, but yeah, it's still the same pattern, right?
Same pattern. Yep.
Okay,
Just always find the thumb.
How would you play it?
How do I? What do you mean?
How would you tell if it, like, you know, the view, like, you know what I mean?
Oh, if it's anterior versus posterior.
Yeah.
One, this whole mess that you see down here, that wouldn't exist. You would be able to see all those bones separate from one another. You really wouldn't be able to see the pisiform all that well because that sits right on top of the triquetrum there. Yes, ma'am. It might, but I won't hold that against you because you're allowed to use your own anatomy. It might. Who knows? Write it in invisible ink. Blacklight it. That's right. Halloween. But Halloween's on Saturday.
Not well, you know something early. That's hard.
All right. Let's do here. Here's the proximal phalanx. I've already done this one, right? So the next one is middle. Come on now. Middle. Come on. Middle phalanx 2, and then finally the last one will be distal phalanx 2. So you can fill in the rest. So obviously, you know, this is the 3rd digit. This is the 4th. And this one's the 5th. So this would be proximal phalanx 3, middle phalanx 3, distal phalanx 3, and so forth and so on. Okay? So I'll let you guys do that because I know you can. All right. So let's talk a little bit here about the hip and whatnot. All right. So a little bit about the lower extremity, okay? So keep in mind, we're still dealing with the appendicular skeleton, so we're talking about either the upper and lower extremities and to the bones to which they articulate with. Same thing here with the lower extremity, all right? It's going to include the lower extremity and the bones that it articulates with, which is going to be, all right, part of your pelvis. So you want to know the difference between, and this is a very good way to lose points if you don't know the difference between the pelvis What page are we on? Does anyone know? Oh, what? We haven't started labeling yet. So, but we'll let you know. All right. You need to know the difference between the pelvis and the pelvic girdle. There's an important distinction between the two. Okay. Yes, the pelvis is made up of 4 bones, but the bones that it's made up of include your right and left hip bone, which we are now going to start to call the os coxa. Okay. It's also the innominate bone, but I prefer to call it the os coxa. Okay, so it's both left and right. And then we've seen these other 2 bones before, the sacrum and the coccyx. Okay, so it's all these bones when they're put together, all right, that they are going to make up the pelvis, which includes the pelvic cavity. Remember the abdominal pelvic cavity, which is found in the ventral body cavity there? Okay, so your pelvic cavity is going to be found here in the pelvis. That's going to include all the different organs down in there. Part of the rectum, sigmoid colon, uterus, urinary bladder, so forth and so on. All right, all that will be found in the pelvis. But the pelvic girdle, okay, the pelvic girdle is only going to be your hip bones, your left and right os coxa. Okay, because if you remember, the sacrum and the coccyx are part of your axial skeleton. Okay? And so, but the pelvic girdle is only part of your appendicular skeleton. The left and right os coxa are part of the appendicular skeleton. Okay, so when we're looking at this, all right, let's take a peek here at the pelvis. All right, here are all 4 bones. That's the sacrum right there. There's the coccyx. Here's the left and right. All right, os coxa. That is your pelvis. Okay, so your pelvic cavity is going to be found in here. Okay, the pelvic girdle, that's the part of the appendicular skeleton that connects to the axial skeleton. Your lower extremities attach to the pelvic girdle. Okay, if you notice a couple things about the male and the female pelvic girdle, all right, the female's is much wider, it's splayed out further, and most of you can probably guess, if not all of you, that it's to accommodate the baby. Okay, male pelvis is actually tilted forward a little bit more. All right, but this area here, okay, on the male, you can't tell at this angle, is actually smaller than the same area here on the female. Okay. You just have to trust me. There's no reason why a man would have a larger pelvic outlet than a female. We don't have to carry the babies. Okay? Okay. So let's jump into and talk about the os coxa. All right, I will not refer to it anymore as the hip bone, maybe from time to time. But it's made up of 3 smaller bones that eventually fuse with one another. And you need to know all 3 of these bones. You have to. Okay? You have the ilium, the ischium, and the pubis. Okay, these will all fuse between the ages of 13 through 15. So during puberty, all right, these bones will start to fuse. So pretty much all of us here, these bones are fused. Okay? And so the os coxa will articulate with the sacrum, all right, on the auricular surface of both structures, and they form the sacroiliac joint. Okay? The sacroiliac joint, that's found on the backside of the posterior portion of your pelvis. All right, so let's take a look at all of these 3 bones and where they are on the os coxa. So the first one, the ilium, that makes up the majority of your os coxa. All right, that's going to be on the superior portion of the bone. Okay, so all of this, all right, that's the ilium. All right, the ischium is the part of your os coxa that we're all sitting on right now. We are sitting on our ischium. Specifically, it's called the ischial tuberosity, and that's this structure here. But if we're going to divide, all right, the bone out, it's going to look like that. That's going to be the ischium, and then the front here, that's going to be the pubis. Okay. So your ischium is back here, that's what you're sitting on, and then in the front here, that front portion, that is your pubis. Some people sometimes will call it their pubic bone. All right, but if you're laying on your back and you find your belly button and you go about 2-3 inches down from your belly button, working inferiorly, if you start to press down, you'll hit your pubic symphysis. All right, and that's where the two pubic bones or pubis bones from both os coxa meet up with one another, and they form that pubis symphysis, and that's where you'll find the fibrocartilage in between. So if we look here at the pelvis, okay, here you can see the ilium, okay, makes up the superior portion of the os coxa. All right, and then you can see your ischium on the back part here, this part you're sitting on, and in the front, here's your pubis. And that is your pubic symphysis right there. All right, so when you're looking at the os coxa from the lateral view, that's this view here. When you're looking at it from the side, you notice this cup-like structure, okay? That cup-like structure is called the acetabulum. You need to know this because it's the acetabulum. It's called your femoral acetabular joint. That's where your femur bone, right, the bone in your thigh, articulates with your os coxa. It's a ball and cup joint. All right, so it means that one of the bones is a cup and the other bone has a ball on it. Okay, and that's what we're going to see here with the femur. Okay, that's a horrible drawing of a bone, but that's awful. Okay, so that's what we're going to see, and that's the acetabulum right here. Okay, and this is actually a relatively deep joint, so there's a little bit more stability, all right, because there's a big capsule that surrounds this whole joint, and it covers the whole joint. Okay, so in the acetabulum, all three of your bones, your ischium, your ilium, and your pubis, have all fused inside there. Now, you don't need to know this structure for identification purposes, the lunate surface, but that's a smooth surface on the inside of the acetabulum in which the femoral head will actually roll around on. Okay, so here you can see, here's your acetabulum, okay, lateral view, and then this kind of semi-circular, the structure they call it, that's why they call it, all right, that lunate surface, because it looks like almost like a crescent moon. That's all smooth, all right, bone in there, and that's where your femoral head rolls around in. All right, the ilium. So when you have been told to put your hands on your hips, that is what you're doing. You're putting your hands on your ilium. Okay, specifically, it's called the iliac crest. We'll see that in a second here. All right, but this is the part of the os coxa that is the most superior portion of the os coxa. All right, so it has like the wings that kind of flail out. And so when we go from the front to the back, all right, the top portion of the ilium is the iliac crest. Okay, so if you put your hands on your hips and where your thumbs are, you'll feel two bones on either side of your spine, down by your rear end. Okay, those two bones that you're feeling are the posterior superior iliac spine. If you follow your iliac crest all the way up to the front, if you have your fingers on your hips, where your index finger, the tip of your index finger is on the front of your iliac crest there, what you're feeling there is the anterior superior iliac spine. Okay. Now these sites are areas for muscle attachment, soft tissue attachment. Okay, and we'll talk some about that. Am I the only one feeling my body? I was actually doing it too. It's not cheating on the test if you use your own body. Okay, keep in mind. Keep in mind. All right, so on each side of the ilium there, okay, you'll have this kind of little indentation. I won't say indentation, but it's actually a pretty significant area that it's a depression called the iliac fossa. There's a muscle that sits in there. It's called the iliacus muscle. We'll talk about that later on, okay? You don't need to know these other areas here, but you'll also see on the ilium more on the back side, on the posterior view, so I can write the answers on my body. You don't know what to say to that question. If the moderator or whoever, the proctor, doesn't see it, then, right? You said, no, of course not, of course not. All right, attachment site for the gluteal muscles. So you'll see these lines on the backside. And again, you don't need to know these lines, but these are where you're going to see you've got three gluteal muscles, your gluteus maximus, gluteus medius, and gluteus minimus. And the size of these muscles varies, but also their attachment sites vary. But where they attach to on the backside of the ilium, we refer to those as the gluteal lines, okay? And then on the one portion here of the ilium, we saw it on the sacrum. It's called the auricular surface. And it's the auricular surface of the os coxa and the auricular surface of the sacrum. When we smush them together, they make up the sacroiliac joint. So it's those two portions, all right, that will form the sacroiliac joints, one of the strongest joints in your body, okay? So when we're looking here, all right, here's our iliac crest. So that's like the top of your hip bone there, all right? And then you can see on the inside, this is the lateral view, okay, because I can see the acetabulum. On this view here, I don't see the acetabulum. So this is the medial or the sagittal view. But I can see this area right here. That's the iliac fossa. There you got a big muscle that will just sit in there. And then you can't really tell, but this spot right here, it's highlighted down here, that's the auricular surface. So we'll take the sacrum and we'll put it right up on that, and that's where we create the sacroiliac joint, okay? All right, so you can see, all right, here's the auricular surface, and you can see where we take both the auricular surface from the sacrum and the ilium, all right, put them together, and we got our sacroiliac joint. All right, the second bone that makes up the os coxa is the ischium, okay? This is the more inferior bone, but more posterior, okay? So you've got this structure. The first structure that we're going to see here on the ischium is called the ischial spine, okay? And the ischial spine is this little bump. We'll see it, all right? It's below the greater sciatic notch and then above the lesser sciatic notch, okay? So this is the ischial spine right here, kind of peeking out, and I'll show you. The bone that you're sitting on right now is your ischial bone. There's another name for it. Some people have called it the sits bone. I've never heard that before. Have you guys ever heard of the sits bone? Yeah, neither have I. So the way they make it sound like it's commonplace, but I never heard about it. All right. But anyways, this is where your ischial tuberosity is. The ischial tuberosity is a really cool structure because that is where the hamstring muscles attach to. So the muscles on the back of your thigh attach right onto your hamstring muscle, or excuse me, onto your ischial tuberosity. Okay, and in fact, I'll wait to tell you that story when we do muscles. Okay, but when you're sitting, all of your body weight is sitting on the ischial tuberosity. Okay, and then there's portion of the ischium, right, called the ischial ramus. We'll see this a little bit later on here when we do some labeling. So I'll save that for you. All right, here's the greater sciatic notch right here. Then you've got your ischial spine, and then right below it is your lesser sciatic notch. Your ischial tuberosity is the structure that you're sitting on right now, okay, and that's where your hamstring muscles attach onto. All right, finally, the pubis, all right, this is going to be the superior portion of the lower half of your os coxa, okay? And there's really three components that you need to know for this class. All right, you'll see it on the ischial, on the pubis bone here. You've got this hole here, and above the hole, you've got ramus means arm. Okay, so above the hole, you've got your where are we? Superior pubic ramus, and then below the hole, we've got the inferior pubic ramus. Okay, and then the hole itself is called the obturator foramen. All right, I'll show you a better picture here. But just to let you know, there is no structure that passes through the obturator foramen. Okay, nothing passes through there. Remember what I told you before? Most times when we see a foramen, it's a hole in a bone and stuff moves through it. Well, guess what? The obturator foramen does not have anything moving through it. It's got this dense connective tissue that covers it, and it's just a site for muscles to attach to. Yes, ma'am. What moves through well, you have blood vessels and nerves, specifically the infraalveolar nerve, which is the nerve that's responsible for all the nervous innervation of your jaw. That's the nerve that they numb. Yep. Yep.
I have to get the wisdom teeth taken out.
Ooh.
I forgot about it until now.
If I have time, I won't do it tonight. But if I have time, I'm going to tell you a story about when a dentist asked me to pull out a wisdom tooth out of one of his patients. Yeah, I know. It's pretty funny.
Don't give me any more.
It's funny. All right, let's see here. Okay, we're going to label all that. I just want to see. Okay. Yeah, let's do this real quick here. Differentiating the sexes when we're talking about the pelvis, all right? Because you want to know, all right, the sexual differences, or what we call the dimorphic sexual differences between these bones here, all right? But keep in mind, I mean, really, if you want to go from a biology standpoint, all right, and if we're doing a binary classification of the sexes, male, female, female is the sex, the gender that is for childbearing and childbirth. So if we just think of it from that point of view, all right, when we talk about some of these characteristics, it'll make sense. All right, perfect example. All right, the female pelvis is shallower and wider. Okay, so think about it. You want it wider, all right, to accommodate the room for the baby, but also during child delivery, but you also want it shallower. For anybody here, and I have never had to have a baby leave my body, but I've been witness to that many times, I can guarantee you that the mom is always much happier that the birth canal is only 7 inches long compared to 70 inches long. All right? So think about it. That's why it's shallower. All right? It has a shorter distance for the baby to travel out of the birth canal. Okay? So not only is it wider to accommodate the baby, all right, but we don't want baby to be lingering in there for a very long period of time, so we make the distance from point A, being inside mom, and point B, being outside of mom, short. And so that's why it is shallower and wider. Okay? Obviously, wider hips makes sense. So we're going to see that in the female, the ilium will flare out more laterally. That's what we saw way up here. Okay? Okay. We saw the ilium here flares out. Can you guys see that? Pick up on that? So if we were to do the distance from here and here, it's a lot wider or longer than the distance from here to here. I know you just eyeball it, you know? Okay? And if you don't believe me, just trust me. All right. Where'd I go? Oops. This is the one. Okay. So they're going to flare out more laterally, okay? But at the same time, too, because the ilium flare out a little more laterally, the acetabulum is going to flare out more laterally. That is another reason why women have a better center of gravity than men. You do. Ladies, you have a better center of gravity. That's why you are supposed to, I mean, physiologically and anatomically, you're supposed to be better rock climbers than us. But just saying. All right, and then also the greater sciatic notch, I'll show you that when we do the labeling. All right, that's going to be a little bit wider too, again, to help accommodate for the passage of the baby during childbirth. Okay? Well, partly because the sciatic nerve is in close proximity, and when the baby moves around, especially when the placenta is expanding, it can, depending on where the baby is sitting, most times they're usually in their 3rd trimester when they have that complaint, and hopefully the baby's in the head down position. Sometimes it doesn't necessarily go that way, and the baby's rear end is rotated and will butt up right against that sciatic nerve and cause mom a lot of discomfort.
Like, is that in the light or
Yeah, sciatica? Sciatica is pain. I mean, legitimate sciatica is pain traveling down all the way to the bottom of your foot. People will say, oh, I got pain in the back of their leg, but it stops at their knee. That's not sciatica. I know what they mean. It's similar, but it's not the sciatic nerve. Yeah. A couple other things here when we're talking about the differences, okay? Okay, female sacrum, shorter and wider. It's awful, okay? And the one thing that I really want to point out to everybody is this right here, the subpubic angle, okay? And the subpubic angle is going to be this angle that you're going to see between the two pubic bones right underneath the pubic symphysis, all right? So what I mean by that, and I'll show it to you here in a second here, all right? It's going to be wider and more convex in ladies. So let me just jump right over this picture here. Here's the subpubic angle here in men, and look at it in women. See how it's much wider, okay? In women, it flares out way more like that, where the men's is more like that, okay? This drawing is much better than the other one that I showed you, okay? So you can see here, all right, less flaring, okay? Much more lateral flaring here. But look how big, all right, that pelvic inlet is compared to the man's. It's much smaller, okay? All right, let's do some labeling because we can finish this up next week. Wait, not next week, Thursday. Sorry. I keep thinking I know. We just had a weekend.
Wishful thinking.
Yeah, I know. All right, let's do a little bit of labeling here, and then I'll let you guys go.
Go into the debate.
Or watch Waco. I'm watching this show on Netflix called Waco. You guys ever?
Is that about Texas?
Yeah.
Oh, where they
Yeah.
government and the
David Koresh. Yes. The Branch Davidians. It's interesting. Okay. So if you look up here on the screen right now, you folks will see that there's 3 names that you can use. Okay. Coxal bone. Okay. Os coxa. And there's also, you can spell it like it is here, OS, but you can also spell it like this. Okay. Or the innominate bone. So there's several different ones. I'll accept them all. Okay, just spell them right. Just don't put hip bone. Okay, you'll lose points. I just wish that I never put that in the literature. All right. Okay, so here you can see, all right, your coxal bone, os coxa, or innominate bone. So now we're going to break it down into 3 bones. The first one here, all right, up above all this, okay, that's the ilium. All right, just to let you know, this right here, this view is a lateral view. I know this because I can see the acetabulum here. That's a lateral view. Now we're going to take the bone, we're going to flip it over, and everything above this dashed line here, that's the ilium. Now, if you get this on a test and it's just pointing the arrow right to that area there, okay, make sure there's no words, okay? If there are no words, then you're going to label it as, I don't think I've showed it to you. You'll label it as this, the iliac fossa, okay? But if it says what part or what bone of the innominate bone or os coxa is this, then it wants you to say ilium, okay? So I'm just saying it's easy to get confused. All right, wait, where am I? All right, so that's the anterior or the medial anterior view here. All right, now we'll go back here to the lateral view. All right, all this is the ischium. Okay. All of that is the ischium. Right, then we flip it over, and you can see here on the back portion, this is the ischium back here. All right, flipping it back to the lateral view, this right here, that's the pubis. And then finally we flip it back over. Here you can see the pubis here from the sagittal medial view here. All right, now we're just going to look at some of the different landmarks that we find in all three of these bones here. Okay, the first one is the quite obvious landmark. That's the acetabulum. That's going to be the cup portion of our femoral acetabular joint. Right, you'll only be able to see the acetabulum from the lateral view. So this actually should be continued all the way down here. Okay, this top margin here. All right, that's our iliac crest. That's the top of your hip. And the iliac crest runs from this big bump here to this little bump here. Okay. So that little bump is referred to as the anterior superior iliac spine. Now there is an anterior inferior iliac spine. That's down here, but you don't need to know that for identification purposes. Okay, so that's the anterior superior iliac spine. This is from the lateral view. Let's flip it over, and you can see it here, all right, on the medial or sagittal view. There it is, the anterior superior iliac spine. That's in the front. You got to make sure that you know which is the front and the back. This is the anterior. This is the posterior back here. How do I know? One of the reasons is because the ischial tuberosity. Yes, sir.
Can you label it as AES?
ASIS? No, you got to write it out. Yeah, I know. All right, so now let's flip it over to the lateral view. And you can see on the back here, now this is a bigger one. That's the posterior superior iliac spine. Like I said, you'll feel two bumps on either side of your spine down in your low back. You keep going down, and that's what you're feeling. Those are the posterior superior iliac spines. All right, and yes, you do have a posterior inferior iliac spine. That's this little bump down here, but you don't need to know that for identification purposes. So let's flip it. Here you can see it. Here's the posterior superior iliac spine. All right, so staying on this view, we're just going to go back to the front here. All right, this nice smooth area right here, all where it's smooth, that's the iliac fossa. And the muscle, it's called iliacus. You'll learn that in the muscle chapter. All right, that lives right in here. Okay, so that's the iliac fossa. All right, and then the last part here that you need to know on this portion of the bone, that's the auricular surface. That's where you're going to see, all right, where the sacrum is going to articulate, all right, with this part of your ilium. All right, so now we go just below that or inferior to that, and you can see the greater sciatic notch. It's this whole spot right in here. Your sciatic nerve is going to run through that. So it's going to exit out of the pelvic cavity there and go down the back of your leg. All right, let's flip it over and look at the lateral side. There's your greater sciatic notch. Okay, so just below the greater sciatic notch, you got that little bony protein that's shooting out. All right, that's your ischial spine. Ischial spine is going to separate the greater and lesser sciatic notches from one another. There you go. There's the lesser sciatic notch. Okay, so then just below that, and staying on the posterior side, okay, just below that, we have our ischial tuberosity. And that's where your hamstring muscles attach onto. That is the part of your pelvis that you are placing all your weight onto right now as you're sitting there. Okay? That's the ischial tuberosity. Okay, on to the last bone of the os coxa. That's the pubis. Okay? So this top part right here, here's your foramen magnum. Okay? The bone that goes on the top of the foramen magnum, that is your superior pubic ramus. Okay, this is it from the medial or sagittal view. Let's flip it over. It's really hard to see from this angle, but that's all there is to it from this angle. Because like I said, here's your foramen, the obturator foramen, and then you got part of the bone. Okay? And this is the superior pubic ramus. I thought it was the did I say, yeah, you know what? It's funny that you just typed that because I thought I said foramen magnum. Yes, it's the obturator foramen. All right, now we flip the bone back over, and you can see right down here, that's going to be your inferior pubic ramus. All right, then we flip it back over. Okay, so you can see the inferior pubic ramus right here. All right, obturator foramen. Yes, good, yes. Alexa, that's right. It is in the head somewhere. It's in the occipital bone. It's where your spinal cord exits from your brain pan, or your cranium. I can guarantee you that'll be on the test. All right, so the pubic symphysis, normally there's a disc here as it articulates with the other pubic bone. All right, this is a way better picture of it. That is the pubic symphysis. Okay, so then on our pelvis here, you can see there's the acetabulum. So what do you think, male or female pelvis? Because you can almost expect that you'll be asked that. Male, female. Female. Remember this subpubic arch here, nice and wide, and these kind of flare out a little bit more.
Are those more like up, right?
Pardon?
Are those more like in? More?
Right, yep. I would look, probably the best way to look on some of these models is to just look at the subpubic arch. That's usually the one that gives it away a little bit better. All right, which one was that? All right, acetabulum. And then here you can see sacroiliac joints. Do not call them SI joints. You will be marked wrong. No, don't. Sacroiliac joints. All right, so here, I jumped the gun on the last one here. There's the female pelvis, which is the one that we just marked. Now, again, really take a look at this here compared to that one. You notice the big difference? This here, okay, compared to this one. Big time. This here, the distance from here to here, it looks almost the same. You know, that's a tough one. These aren't really bad. I mean, it would be a lot easier if they had both of them on the same page, and then they would say, which one's the male pelvis, the one on the right or the left, or something like that. You know what I mean? That would be way better. All right. I'm gonna stop here, guys. Let's conclude early. I let the other class out a little bit early, and I don't like you quite as much as I do them, but also, no, I'm joking. I'm joking at home. All right. Is there any questions for me at home?